Hi everyone, Ellie here again. So today we're going to talk about advanced care planning and your action plan. So hunker down, let's get it started. I am just going to share my screen here, so bear with me for a couple of seconds till I get it set up. Okay, advanced care planning. It is more than just a piece of paper. It's a lot more, actually. It's a way of reflecting on your values and your wishes and what you would like to have happen to you in your final days, if you're not able to speak for yourself or if you are able to speak for yourself. Either way, it's going ahead into the future and having a look at how you would like things to play out. If you're not able to make decisions, it's good to have a plan in place and tell people about it so that you make the right decisions for you. And the third thing to look at is your definition of quality of life, not anybody else's, just yours. Having a really close look at that and defining what is the most important to you and what is the least important to you. And having those kinds of things fleshed out, it makes the whole process a lot easier to continue with. So having the conversation with your family and loved ones is so very important. If you don't take anything else away from today's session, please do this. Sit down with your loved ones all in the same room at the same time, so that everyone gets the same message that you're trying to give them. It's really important that everyone knows and is on board, because if you do it individually with people around over time, it can end up getting a bit misconstrued and people can perhaps misunderstand. But if more people are hearing the same message, they can always steer the ones that are maybe not hearing it quite the same way you're trying to pitch it, and help them better understand what it is you're asking for. So it is really important to have this in place so the people that are making decisions on your behalf know what is important to you, and be able to direct the flow of healthcare after that. We do care for each other, and this is one of the best ways we can do that, just making sure that your voice is heard when things go south. So advanced care planning step number 1, think about what's right for you. What are your values, beliefs, and understandings about the end of life procedures? Do you want cardiopulmonary resuscitation, CPR? Do you want dialysis or drug therapies, a tube, a feeding tube, intravenous, things like that? So in order to better understand the things that we do on the other side of the hospital walls in critical care areas, there are 2 workbooks that are available to us that you can look through and work your way through and write down what you want and write down what you definitely don't want. So you had a better idea of what we do, so that you can make informed decisions on how you want the end of your life to play out. And have you experienced any of this before, of somebody that has been critically ill in an intensive care unit? And how did it make you feel? Could you see yourself in that situation, or would you rather not have those things done to you? It is entirely up to you. So learning about the options, as I said, there are things that we do in critical care medicine that you may or may not want us to do. And the workbooks are a really good place to start for that. If you don't want medical intervention, that is your call too. Or if you want some, but not all of it, then that's your choice too. For instance, I started my advanced care planning when I was 28 years old, when I had my first child. And my ex-husband took me away on a trip. The baby was 4 months old. So I said, oh my goodness. And this is the first thing that came to me, is what happens to Kyle, to my baby, if neither of us come back from this trip for whatever reason. We did, by the way, obviously. And everything was fine, but I just thought I better have things in place. So we drew up a will. I had things in order for care for my son. I was very upfront. I said, I don't want anything to do with keeping me alive if there is nothing left in my brain. If I'm brain dead, as we say, or there is no brain activity and I will not resume my normal life, I don't want anything to do with that. That stands. I'm still that way. Cardiopulmonary resuscitation, if you find me and it's been a while, like more than 4 minutes, if you don't see me drop, then don't bother, because I just don't want to be in that position, or putting my family in that position, having to make the decision. So those have not changed. I'm steadfast on that. My beliefs, my wishes. But I have changed my mind about paralysis. I wanted nothing to do with being paralyzed at all, period. I wanted it to end, but now I've come to terms with having bad knees, so I could probably deal with being paralyzed from the waist down. I could probably do that, seeing people running around in their wheelchairs and hopping up into their vehicles and dismantling the wheelchair and popping it in the chair beside them or whatever. I could do that. I could make that happen, but that's changed over time. So it's something that needs to be revisited every now and then. Don't dwell on it, but do revisit it maybe annually or every 5 years. And definitely when things are changing for you health-wise. There's no right or wrong answer. It's your answer. It's what works for you entirely. So step number 3, decide who will make medical decisions on your behalf if you're incapable of doing so. It may be your partner. It could be your sister, brother. It could be a really close friend. It could be somebody that you've known for a long time professionally, but you're not paying them to deliver service for you, to you. It should be someone that has similar values and beliefs as you, so that you're confident that they'll carry out what you want. If they're vehemently opposed, then that's probably not the right fit, not the best fit. If you could find someone else. The person's called a substitute decision maker, and they will be your voice if you are unable to speak for yourself. Now, in order to get this on paper, it is absolutely best to go through a lawyer and get a power of attorney for personal care written up. This way, your substitute decision maker is named and has legal authority to make decisions on your behalf if you are not able to make those decisions yourself. Up until the moment you're not able to make those decisions yourself, it is in your ballpark. You're in the driver's seat. You make the decisions. Step number 4, start the conversation. Get the family together and, maybe get your substitute decision maker first. And then when you get the family together to tell them what you would like, then it's a good idea to tell them who the substitute decision maker will be, and that's the person that is going to ultimately make the decision. They can ask for help from other family members and loved ones, friends, etc., but at the end of the day, if you're not able to make that decision, they make it for you. And make sure you tell them in a quiet setting where everyone is there that should be there. So they're hearing the same message at the same time. And let them know what kind of care you would like to receive. Do you want to be in a nursing home? Do you want to be in a palliative care center? Would you like to be in a hospital? Would you like to be at home? So all of these things are good to kind of pre-think it so that your family members and loved ones aren't struggling when they're braced or faced by an emerge physician saying, okay, what does she want? What does he want? And you have to make those decisions not knowing. That's the hardest thing for everybody. Number 5, write it down. Make sure that your substitute decision maker has a copy and ensure that all of your family knows. There are many resources available online to help guide you through these processes. And as I said, there are 2 workbooks that are available that I'll put up at the end of this program. This is called a Do Not Resuscitate Form. It is a form that we use for allied healthcare professional like police, emergency services, police, firefighters, and paramedics. So if you have this form completed, and somebody by mistake calls 911, then we as emergency responders, firefighters, paramedics, police, if we see this document, it's presented to us, then, and it's all signed and everything is filled in exactly as it should be, then we will not proceed with the measures that the person has identified. We will give supportive care. We will give comfort care. So we're going to give oxygen, or the paramedics will give analgesia if we need it. We can definitely help keep you comfortable. But if you say specifically on this DNR, do not resuscitate form, you don't want CPR, you don't want anything that's that is aggressive in therapy, then you just say so, and we offer support measures only. The form does have to be completely filled out. It has to be signed by a physician or a nurse. The nurse can be a nurse practitioner, it could be a registered nurse, it could be a registered practical nurse. Any of the 3 classifications of nurses are good to sign, as well as a doctor. It's only used in the community. Unfortunately, it doesn't apply to the hospital setting, so you're going to have to go through that whole decision-making tree again in the hospital, because they don't see it as a viable instrument. They have to ask their own questions. This document, you can change it again at any time. You can pull it, you can say or get it, whichever you'd like to do. Now, in order to get this document, you would have to speak to your doctor, and your family doctor will contact the Ministry of Health, and they will get the form on your behalf. When they have the form, they'll fill it out with you. They'll explain what it means. You give them the opportunity to write down, or the opportunity to write down what you want and what you don't want. When it's all signed and sealed, it has a serial number, which is up here. There is my mouse. Right here in the corner. And that's specific to you and nobody else but you. After it's all signed, you can make as many copies as you want and give them to people so that they all know you have this, and preferably don't call 911. And that would be discussed with you, with a physician, to make sure that you don't call 911 when the person is passing, because that's the whole idea. They want to die with dignity, or die peacefully and respectfully and gracefully. So that's kind of how that all works. I do have handouts. If you would like the handouts, I'd be more than happy to send them out to you. So let's talk about real life situations. We have Laura and Tom. They were married this past summer. Unfortunately, a car accident left Laura unable to speak for herself and in the local emergency department. Let's look at a couple of scenarios and see what happens when advanced care planning was and wasn't talked about. So here's Laura and Tom without an advanced care plan. When Tom spoke with the emergency room physician, he was asked questions such as, do you want Laura to be put on a breathing machine? Do you want us to perform advanced treatment if there is no chance that she will recover? And Laura's heart has already stopped once. We performed CPR, that's cardiopulmonary resuscitation, chest compressions, ventilations. Do you want us to do that again? Tom is feeling upset, panicked, and does not have confidence in making a decision. He's afraid and scared of doing something that Laura wouldn't want. He also now has family members making decisions that he thought maybe Laura would not have agreed to. Puts him in a tough position, doesn't it? So this time around, they have an advanced care plan. Because Laura had gone through the death of a close family member, she knew how important it was to have someone understand her wishes and treatment plan if she was unable to speak for herself. Before they were married, Laura and Tom sat down, reviewed Laura's advanced care plan, which described the kind of care that Laura would want. When approached by the emergency room doctor, Tom had the confidence in making those treatment choices that reflected Laura's plan, and it brought comfort to him, knowing that he was doing what his wife would have wanted. It just makes it so much easier. It's already a really tough time and really, really difficult decisions to make, but it does make it more comforting to the person that has to make those decisions. So here's another one. After being investigated for a new cough, Robert just found out that he's been diagnosed with stage 4 lung cancer. Let's learn about Roger's experience with advanced care planning. So thinking about what's right for you, going back to, I think that's step 2 or step 1 maybe. Robert wrote down about wanting to die at home with his family dog by his side. He wants stories, laughter, and memories shared. Robert felt strongly about the good quality of life rather than time spent living with pain. Robert wouldn't want to prolong life, but being on a breathing machine or having his heart resuscitated should stop. So learning about end-of-life options and procedures. After speaking to his healthcare team and learning about the end-of-life options and procedures, Robert communicated that he would accept hydration fluids by intravenous if that would improve his quality of life. Robert also agreed to drug therapies to help keep him comfortable at home, but would prefer not to have it affect his cognitive status, if possible. So he wanted to be alert, but not in pain necessarily or uncomfortable. So decide who will make the medical decisions on your behalf, should you be incapable of doing so. So Robert discussed it with his wife at length, and he decided that his best friend and family friend, Ted, would be his substitute decision maker. Robert wanted his wife to be able to focus on herself and the family. Since Ted has been a part of the family and shared his values and beliefs, he seems like the right fit. Ted agreed and sat down with Robert and his wife to review his advanced care plan. So Robert and his wife then sat down with their children and reviewed the advanced care plan with them, explaining who would be the substitute decision maker, that it would be Ted. Robert brought a copy of his advanced care plan to his next visit with a doctor and oncologist and reviewed it with them. The doctors kept a copy on file. Robert and his wife met with their lawyer to review the plan and to keep it on file. So all these steps are really important, that everybody is aware of what you want and how you would like it to play out. So Robert took the time to write down his advanced care plan. This is a really great thing to do. I did it for the first time probably 4 years ago, that I actually physically wrote out everything and made the changes that I talked about earlier. He used the Speak Up workbook as a helpful tool. This workbook was shared with Ted and his wife and family and the healthcare team, so everybody knew what he wanted. So you're probably saying to yourself, I'm not really sick though, like I'm doing better. Why should I talk about it now? A lot of people don't really want to talk about it because it's an uncomfortable topic. But any adult should prepare an advanced care plan. Remember, you can change it as often as you want. And as I said, I started when I was 28, so it's a good thing to have. So some last points. It's all about starting the conversation. It's a reflection of your values and beliefs and what kind of care you would like to have for yourself in the future. It's a fluid document, and conversation will change over time, and that's okay. So these are the resources: Speak Up Ontario and Dying with Dignity. Dying with Dignity has probably more detail on the things that we do in the hospital setting. Speak Up is more scriptive, you write. It does give you some ideas, some concepts of the more critical things that we do, but they both give you a good idea, a good appreciation of what happens when you're in a critical situation. So those are really good ones to look at. So the next one we are going to talk about is action plan. So everyone is going to get an action plan or a plan of action, however you want to express it, at some point during our respiratory program, however, whatever it looks like. So what we want you to do from the very beginning, and this has come even more and more clear with COVID, and thank heaven we've been speaking about this for a long time because our respiratory patients have, touch wood, tolerated COVID really, really well, rode the storm well, very well. But these are the actions that they've been doing all along in life before COVID too. So nothing has really changed from that perspective. It just really hones in now with this pandemic. So always take your medication as directed, as shown, and as frequently as you need to, as you're supposed to take it. Eat well, get enough rest. Sleep is critically important, more so than we have ever thought in the past. exercise, exercise, exercise. Regular exercise is critical. 150 minutes a week cardio, moderate cardio is very, very healthy. Heart healthy, lung healthy, brain healthy, physical healthy, everything. If people are sick, stay away from them or ask them please to not come around you. Get your flu shot every year. Ask about getting the pneumonia shot. There are 2 available. It's best to get both of them. They will not be given at the same time. There is spacing involved when you have both pneumonia vaccines, but they do cover quite a few of the bacterial pneumonias that are out there. So highly recommended. Wash your hands properly and often, especially when you're out in public. So that's 40-second wash with soap and water. Good old soap and water. So this is the first page of your action plan. It has resource people, how you feel when you feel well, what you're going to do, what is your regular dosage medication. So this just speaks to washing your hands properly, sing happy birthday song twice, and scrub everywhere on your hands, under the nails, in between your thumbs, fingers, front, back, everything needs to be really scrubbed well in at least 40 seconds. So if you have a flare-up, if you notice you're getting sick, then that's when you have discolored mucus, unless you normally have discolored mucus. Well, most people have clear to white mucus. If it turns green, yellow, brown, and or you have more of it, or you're coughing more, if you have a fever, morning headaches, dizziness, trouble sleeping, an unusual increase in shortness of breath, because most people with chronic lung disease have shortness of breath, just feeling more tired, exhaustion, fatigue. Those are things that should be spidey skills to tell you that things are changing. So that's when you're entering the yellow zone. So the first zone was green, this zone is yellow, and this is where we do your action. So your respiratory therapist, respiratory educator will be filling out the bronchodilator piece. And if you have been given a prescription for antibiotic and or prednisone, then they can fill that out based on the physician or nurse practitioner's prescription. Otherwise, we don't fill that one out per se. Your doctor can, you can. We'll just be putting in the Ventolin. So what we want you to do here is start taking your Ventolin more frequently when things change, when you get sick. We also want you to contact your physician or nurse practitioner, and don't wait any more than 2 days. 48 hours is tops, okay? You have to make sure you make that call so that they know and they can prescribe antibiotics and or prednisone if you need it. So hopefully that action in the yellow plan will put you into the green zone. Otherwise, if things don't get better, you're heading for the red zone, which is danger, right? Always danger. Your symptoms are worse, more cough, more fever, delirious, perhaps blue. You could be turning blue. So any of those things that are showing that you're not getting any better, even with the medication, you need to get into Emerge. And the best way is to call 911 and then they will come and pick you up, treat you on the way to the hospital, and you'll be at the head of the queue when you get into the emergency department. So really, really, really important to try to avoid the red zones when at all possible, and take the action, listen to your body, and do what you need to do in the yellow zone to get back to the green zone and live your happy life. So that's it for today. If you have questions, don't hesitate to reach out, and we are here for you. So phone call, message in Facebook. Take good care, everybody. Bye for now.